Welcome back to Houston Life. NexGenEsis Healthcare provides the highest quality of care with the latest technology and techniques to help relieve your body from nerve and joint issues. Get this, without surgery. And I am here with Dr. Nadim Jamil and Dr. Joseph Furman with NexGenEsis Healthcare, and today we are talking about neuropathy. First of all, Dr. Furman, this might be a word that a lot of people don't even know what it is. Can you explain to our viewers neuropathy?
Yeah, so, these patients, they're going to be coming in with symptoms like numbness, tingling, burning, electric shock-like pains, typically in their hands and their feet. And, they're going to have maybe some balance issues, which is very common with this. And, this is going to keep them from getting around like they normally can or need to or want to, kind of taking that independence away from them as well. Over time, this just continues to get worse and worse typically, and it can be very detrimental to their quality of life.
Now, what causes this?
Yeah, so there's lots of causes, the most common being diabetes, okay. But there are other causes such as past traumas, surgeries, chemotherapy, rheumatoid arthritis, lots of different causes, but definitely the most common is diabetes. And like I said, with this getting worse over time, it does progress. It progresses and it progresses. So somebody could come in, that have had burning in their feet maybe once per month, and then it progresses to, once per week and then once per day. And next thing you know, they're unable to sleep at night due to the pain. And, this can just have a severe effect on their overall quality of life.
The problem is when people start to ignore those symptoms and maybe think, oh, I wore a tennis shoe that was hurting my foot too tight. Let me blame the pain on something else. But
Absolutely.
Really, they shouldn't be ignoring that.
Absolutely.
Now, Dr. Jamil, what does a traditional treatment for neuropathy look like?
So typically when patients present to the doctors, common prescriptions are Lyrica or gabapentin or Neurontin. These medications really taking care of the symptoms. They are not treating the cause. And as the disease progresses, physician typically, myself too, increase the dose. But these medications have side effects, and those side effects sometimes can be detrimental or prohibitive for patients to take care of their symptoms. And we keep increasing the dosage to the maximum, and disease will continue to progress. At that time, we'll say we can't offer anything else.
And it's almost as if you don't have a cure because the medication has to stop at some point, right?
At that point, medication stop working. But fortunately, we have other treatment options that we can offer that works naturally and work on the body mechanism to treat it if diagnosed at the early stage. The key is to diagnose at the early stage. If the disease is progress and unfortunately we can't do much at that time, we may not get the optimal treatment.
So what does that look differently at NexGenEsis Healthcare?
So NexGenEsis will try to put the body in the most natural position and natural healing process, recruit the body mechanism to fight these inflammatory markers, and once it start working. This process is slow, it's not immediate, so we try to have the body cells change their behavior, and if we can do it by giving this treatment, most of the patients are very happy and we are very excited about it.
I'm excited just thinking about using your own body to help cure your body. That's what your body is supposed to do.
Absolutely.
Right? So let's get the word across that basically, Dr. Furman, it's imperative that you get checked out immediately almost.
Yeah, absolutely. A major cause of concern of neuropathy is that it can get so bad that, you could be facing amputation. That's a very real possibility. So it's very crucial to get this examined and checked out before it's too late.
And what does too late look like from when patients come in and there's no other treatment options, as you mentioned before?
Mm-hmm. So at that time, it affects their quality of life. They cannot walk. Most of the time living with constant pain. Quality of life is suffer. And it's a constant pain and living with agony.
Yeah, well, we definitely suggest all of our viewers, if these symptoms are something that you're experiencing, to get in and get those symptoms checked out. And right now is the best time to do it because NexGenEsis is offering a special. If you are in the first 100 callers to mention Houston Life, you get a complimentary phone consultation with a provider to see if you're a good candidate to come in for an exam. Just call 832-570-4529 or log on to nexgenesishealthcare.com. Houston Life will be right back.